What's going on, everybody? You already know who this is, Pat the Dentist. Reason why I'm making these videos now is this is a little mini series, and it's because when I first started working, I had a lot of trouble trying to convince patients to get the treatment that they needed. And reasons being was because I didn't necessarily know exactly how to put things in simple terms so a patient can understand something medically complex. And so I realized when I started to learn how to say certain things, certain trigger words, my case acceptance went up. And so I'm gonna go through and put out these videos every once in a while for particular types of treatment. So this is not a diagnosing type of mini-series. This is assuming you believe a patient needs a root canal, a crown, SRPs, whatever. And I'll kind of walk you through some of the things I say so I can get my case acceptance a little bit higher. And so with that being said, this one is about scaling and root plantings and the things I say to my patients so I can get them to start that type of treatment. So we already assume patient needs SRPs. They have periodontal disease. That's our assumption, right? How do we get the patient to accept the treatment that they need? And so what I always do before I start doing any type of periodontal exam is I phrase things so patient can expect certain things. So what I say to my assistant, what I say to my patient is, okay, so I'm gonna be checking the health of your gums right now. The way I'm gonna do that is I'm gonna measure the pocket depths in between your teeth. Numbers that I'm gonna read out to my assistant that indicate health are between 1 to 3. A couple 4s here and there is okay, but any 4s with bleeding, any 5s, 6s, anything higher than that is an indication you have something called periodontal disease and something we have to address. Okay, cool. So what does that do? That basically sets the tone for the patient. They're gonna be listening to the numbers that you're telling your assistant. So they wanna hear 1, 2, 3. They hear 4, they're like, oh damn, that's not good. Then if you start saying 5, 6, 7, they're like, holy crap, this is not good. So you already set expectations. These are what indicate health. And so they're not being blindsided or assuming after you do the exam, whoa, what do you mean? Like, he's just lying to me now. Like, I don't believe anything he or she is saying. You set the expectations that 1 to 3 is healthy, a couple 4s here and there is okay. And so now the patient knows. So then at the same time, if you have bleeding or pus or something like that, don't say to your assistant, I have BOP on 7 or on the distal of 7 or suppuration, which is the word for pus. Patients, they don't know what the hell that means. You wanna say, so-and-so has, or there's bleeding on tooth number 6. There's pus on tooth number 6, because that registers in the patient's mind and they're like, what? I have pus there? I have bleeding there? So keep that in mind when you're explaining, when you're basically doing the exam. So now it comes down to the exam's done. Patient, you decided needs SRPs. How do we get them to accept treatment that is ultimately going to be more expensive than just a regular cleaning, which lots of times they probably expected. That's what they're going to be getting, a regular cleaning. So that's not the case. So they need SRPs. So what I do is I set up the patient. I say, you probably heard some of those numbers. So it's pretty obvious to me that you have periodontal disease. Then I say whether it's localized or generalized. And lots of times patients nod their head. They're like, yes, okay, damn, that makes sense. That sucks, I have that, but okay. They're thinking that in their head. And so what I say, this is the thing that really, really resonates with patients and what gets them to understand what periodontal disease is. So I always say this to every single one of my patients that needs SRPs. What I say is, so what I always say to my patients is periodontal disease is very similar to a house in the sense that you have wooden framework that supports the house, but if you have termites eating away at that framework, eventually the house is going to collapse. And this is no different than what you have going on in your mouth right now, except bacteria is eating away at that bone that supports the teeth and keeps them in place. And so when you can create an analogy for patients to understand why it is that they need something, things make a lot more sense. So they're sitting there nodding their head. They're like, damn, this totally makes sense. This is what's going on in my mouth. And so when you can remove the complex medical terminology and simplify it so the everyday person can understand what it is that's going down in their mouth, they're more likely to accept treatment. And that's what I've realized is when you use certain trigger words. And then you go and you start describing what it is that's going on, or you might show on x-rays, or you might show on intraoral photos, the calculus. What I always say when there's calculus present on lingual anteriors, what I say is, this is something we're going to physically remove. What this does, this calcium, this buildup does, is it helps peel back the gums, and it makes it that much more easier for bacteria to get deep inside and to eat away at that supporting bone structure. So when you're describing what bacteria does, you also want to use certain trigger words, things that are going to really resonate with a patient. So you say something like, dissolve the bone. You have an active bone infection, eating away that bone. You're not lying. That's exactly what's happening. That is what is periodontal disease. It's an infection of the bone in your mouth. So that's accurate. You have to say certain things like that. Dissolve, eat away. And then patients are more likely to accept because they understand the difference between why it is that they need this type of cleaning and scaling and root planing, versus a regular cleaning. So guys, if you're if you're a dental student or a dentist, and you really want to try to get those case acceptances up for periodontal disease related treatment, scaling and root planing, things like that, definitely try to considering interjecting some of the things that I just said right now into how it is that you discuss this type of stuff with your patients. I've seen it work for me. It didn't work before I started saying things like this, but once I did, pretty much night and day difference. So try that out. Let me know what you guys think, and be on the lookout for more of these videos.